Hello everyone, today we are going to learn pre-op preparation of patient for surgery. So that's the name of the task for today. And then it's a trolley procedure where we have two shelves, and the top shelf is for sterile items, or the bottom shelf is for clean items. Remember that this procedure we are going to wash the site, the surgical site, the proposed incision site, to prepare the patient for the surgery, to make it clean enough before the patient is sent to theater. So on the bottom shelf we have sponge and towel in a bowl, in a container. If the towel is big, it cannot fit in the bowl, you put it on the shelf like that. Then we have draw Macintosh and draw sheet to protect the bed from getting wet. We have patient's gown here to put patient in it right after the preparation. We have a sterile glove to wear when we are coming to the sterile field. We have shaving stick to shave the site if it is hairy. Then we have pre-op medications if it's prescribed to give to the patient as well. Then we have the vital signs tray to check patient's vital signs after cleaning the site. We have the disposable gloves to protect nurses' hands. We have antiseptic lotion. We have plaster to secure the sterile towel in position. We have bowls for washing the site. If you have bigger bowls, it's better to use them. We have a jug of water. So if the weather is cold, then you can come with 2 jugs so that you can mix both cold and water. Then we have sablon also for cleaning the site. And when we come to the top shelf, kidney dish with gauze for cleaning the site. We have sterile gallipots, one containing cotton swabs, and one will be for the lotion. Then we have another kidney dish and a sterile towel to cover the site when we are done. So to begin the procedure itself, you have to confirm that patient is actually to be prepared for surgery that day. Mr. Asante, how are you this morning? You are aware that we are going to do incision of the ball here. So we have to clean the place for you as well. Can I go and bring the things for the surgeon? After confirming the order from the surgeon's plan, she had to go and inform the patient about the task. Then after that, you screen the patient, then bring your prepared trolley and come and explain procedure. Mr. Asante, I'm back. Like I informed you, because you are going to theater, you don't want any dust to enter the sites that you are going to do this. So I'm going to wash this whole place with a sponge and towel. And after that, I will clean with antiseptic lotion and cover it nicely. If you feel any pain, let me know. Yes, I guess no problem. I will still wash it because I need to make it more cleaner for theater. Since you are going to wash the site, you have to protect the bed with the dressing Macintosh and the dressing towel to prevent wetting of the patient's linen. And earlier the patient asked that he just took his bath, so does he still need the cleaning of the site, which is a genuine question. And the nurse answered that yes, because we have to make it more clean for surgery. So the nurse will wear the disposable gloves and then get ready to prepare the patient. So every step you have to make sure patient is comfortable while you do it. So she has to put the items at a convenient position in order not to be turning too much or to be bending too much. So you can use a cardiac table or the patient's bedside locker. So this one, you pour your water. You are coming to wash the place, so you pour water for washing and one for rinsing. And then you pick everything you will need. You will need a towel, you will need a sponge, you will need a soap. So you put them at a convenient place that will make the work the items more accessible to you. Yes, like she's doing. So you fetch soap and start washing the site. While washing the site, you have to be very gentle with the patients. You can talk to patients sometimes, and also if the place is painful, you have to take notes. You may need to add it in your nurse's notes, and then just be gentle. Don't press too much, especially the particular site. If there is pain there, don't press too much, and you'll be observing it as well. Remember, we brought a shaving stick. If the place is very hairy, you would have to shave the patient too. So this one, after washing, you rinse. You can bring 2 small towels. You use one to rinse and one to clean. You can also, so you see the patient is in pain, the nurse told the patient sorry, and that's in order. So you can bring 2 towels and use one to dry, and then after that you remove your disposable gloves and put them in a receiver at the bottom shelf. Then you are now coming to clean with an antiseptic, and that one you're going to use sterile things to clean. And know that before you open your sterile field, you have to get everything ready so that you don't open the sterile field, wear your sterile gloves, then go and remove plaster. So she is removing her plasters before she opens the sterile field, in order not to contaminate the field by coming back to take plaster. So you gauge what you are going to do and estimate the plaster you will need. We can't go to the sterile field with our bare hands, so we will need your sterile glove. But first of all, you still have to pour the lotions you are going to use to wash the site, because after wearing the sterile glove, you cannot go to the bottom shelf to take anything. So everything you will need, this is antiseptic, and I think it's a spirit, and the first one was Savlon. So now you open your glove. I have a video on how to don surgical gloves, so you can watch that one too. You open your glove, and before you don any type of glove, you have to perform hand hygiene. You don the surgical glove the right way, not contaminating the surface. Then you are going to wash with the Savlon. This is a diluted Savlon. You wash the site. The patient is in pain, so you have to be as gentle as possible and wash the site well. And nurses have a way of washing things. We don't do back and forth. We just clean in one direction. So always the things you will use, if it is not, that thing is not going to be in sterile use, you can bring it to the bed for easy access. So she brought the receiver for use swabs on the bed. After cleaning with the Savlon, she cleaned with the methylated spirit, and now she's going to cover it with the sterile towel. So now she's done with all the sterile stuff. So you can now clean your hands with hand rub, alcohol hand rub, then secure the sterile towel in position. So now the site will not be opened until the patient is at the theater, where the pre-op nurses will also take over from. So you secure the surgical towel in position. Then so you have to put the patient in the theater gown. So if it's a real patient would have to remove the pajamas or the shirt she is wearing, but you can't go to the theater in that shirt, and rather put on the theater gown. So don't forget that you have to do it that way. And then you have to check patient's vital signs. And the vital signs, you have to check it at a site that it will not cause pain, because now we have covered this side. We don't want to check it on the left hand, it will cause pain. So she rather came to the right hand side of the patient to check the vital signs. And that is going to be the last vital signs of the patient on the ward before the patient is sent to the theater. So you do the vital signs the right way, just like how we check vital signs. I have videos on checking vital signs, including the various components and even how to chart them. So you can go and watch those videos. So vital signs include the temperature, the pulse, the respiration, and the blood pressure. So while the thermometer was there, the nurse checked the pulse and the respiration as well. So when you take the thermometer out, you have 3 things: temperature, pulse, respiration. You record on a paper, then you come and check BP. Always, any task you are doing on the patient, ensure patient is convenient. And then, so she's checking the BP now. And you should always have your second hand watch, which is usually the breast watch of the nurse. So when you are done, you pack the sphic back into its case. Then you send your tray. You thank the patient for cooperation, assemble all the items you brought and send them back and put them in its right places. Then you wash your hands. You also remove the screen as well. Wash your hands after every task. You don't have to use just sanitizer. After the task, do what to wash your hands to protect yourself and other nurses and other patients. Then you go and document the procedure. Document it in the nurse's notes. Sign.